Hello all, hope you're having a great day today. So today we are continuing our conversation in chapter 17 and looking at what is the neutral position and why it is so important. So Panjabi describes the neutral position as the posture of the spine in which the overall internal and stresses in the spinal column and muscular effort to hold the posture are minimal. A nice illustration of mechanical importance of neutral can be seen in a tent that is supporting wires equally tight around the structure. Conversely, if one set of support wires is tighter in comparison to the other side, the tent will likely collapse. And humans, maintaining neutral is important because it organizes the body into its most biomechanical, efficient posture. More specifically, neutral position optimizes ideal muscle length tension and force coupling relationships. It also minimizes compressive and shear forces imposed on the joint and optimizes the timing and speed of contraction of stabilizing muscles. And you can see here's an illustration of the neutral position, with A being that there's too much arch, B where it's too flattened, and C that is considered to be neutral, or the good posture. And further down, you can see in E that they're slouching while sitting, versus F where they're in a good neutral or good position. So a widely held belief is that simple body weight movement is an appropriate place to begin a strength conditioning program. This logic is based on the assumption that the client already has sufficient proprioceptive acuity, mobility, and appropriate command of the stabilizing muscles to maintain optimal alignment. Given the pervasive contributors of muscle imbalance described earlier, this assumption is a chancy supposition whereby further exploration of the client's true movement baseline is likely needed. Considering the majority of fitness assessments will take place in fitness centers, gyms, and studios without the use of sophisticated laboratory equipment, the most pragmatic strategies for the personal trainer or fitness professional are left to observation of static and dynamic postures and symmetry of movement. It is important to note that if pain is present during any of the following assessments or exercises, the fitness professional should recommend a medical exam by a qualified medical professional. Although static posture does not necessarily capture how an individual moves, it does provide the personal trainer some insight regarding specific muscle imbalances. This information can then be used in the selection of stabilizing exercises and stretching and self-myofascial release strategies. Static postural assessments also help clients develop an awareness of neutral posture, which holds great relevance when clients are performing dynamic movements that require maintenance of neutral while under load, like the squat or the lunge, the deadlift, or the farmer's carry. Wall test is, in addition to the plumb line assessment, a wall assessment of normal lumbar curvature and forward-headed posture is helpful. Instruct the client to stand with his or her back against the wall and feet approximately 6 inches from the wall. Ideally, the back of the head should be positioned against the wall, and the assessor's hand should be able to fit snugly in between the wall of the client's lumbar spine and the wall. Taken together, these static postural assessments expose areas of tightness and or weakness. There are occasions where simply drawing the client's attention to the postural distortion and offering verbal cues will prove helpful. Additionally, Table 17.5 offers specific stretching targets that correspond to listed postural deviations. Use of a plumb line or static posture app is useful in identifying deviations from the neutral position. Clients should be barefoot, wear form-fitting clothing that enables the assessor to identify bony landmarks, and be encouraged to assume their everyday relaxed posture during the assessment. And Table 17.4, it describes the basic plumb line postural assessment. But you can see here in the picture to the left the plumb lines that you're looking for. And so in your assessment, The client should stand sideways to the plumb line with the line positioned slightly anterior to their ankle or the lateral malleolus. And there you're looking at, there, does it align? Does their ear align with the acromioclavicular joint, the greater truncator of the femur, and the tibial tuberosity? If you're looking anterior, or if you're facing the client, then you're looking at, you want to align the plumb line with the pubis. And here you're looking at the navel, the sternum, the chin, the nose, and the eyes are equidistant from the line. If they're not, that tells you that there is a misalignment somewhere. These are some stages for neutral posture, where stage 1 is they are lying on the ground, stage 2 is they are seated, stage 3 they're standing, and then you're starting to add in movement with it. So moving from standing and adding in hip hinging. Stage 5 would be where it's a farmer carry with bilateral loading, so weights in both hands, versus stage 6, which you do a farmer carry with unilateral loading, so with just one side loaded. So these are some alignment issues and soft target tissue targets. You can see alignment faults, excessive kyphosis of the thoracic spine. So here, really working on trying to release, it's called self-myofascial release of the pectoralis major and minor, and stretching the latissimus dorsi. So basically they're curving forward, as you can see in the individual on the right hand side, the farthest right. Their shoulders are pulled forward, and so really working on trying to release muscle tissue as well as to stretch. If they've got internal rotation of the shoulders, here you want to again work on the pectoralis major and minor, but also the latissimus dorsi. And then if they have a posterior pelvic tilt, it's going to cause it's going to cause tension in the hamstring. So you want to stretch and try to release that, as well as really working on the abdominals and strengthening. And then hyperextension of the lumbar spine. There you want to make sure that you're doing that release of the quadratus laborum, and also stretching the quadriceps and the iliopsoas that can get really tight. So this is just some alignment fault. It's a checklist that you can utilize. But once they lose that cervical neutral, where the head is positioned in front of the body, or tilting it, much like what you saw with the individual where they rounded out their thoracic spine. So you want to really work on strengthening that upper back and strengthening primarily. So some different things that you can do here with stretching and strengthening as well. They have an anterior pelvic tilt. It causes an excess of arching in the lower back. So here, really working on strengthening the abs and stretching the back muscles. And then knee valgus is where their knees collapse. So here, really working on some lateral work to help strengthen the musculature there. And these are just some corrective suggestions for posture. If they have a forward head posture, really suggests that they work on tucking their chin in and stretching the pectoralis major and minor, as well as the latissimus dorsi and the abdominals. And then some other suggestions: if they have increased thoracic curvature, while tucking their chin, stand or sit as tall as possible. And again, really working on helping to strengthen, but also stretch and create a balance, if you will. So if there's an internal rotation of the shoulders, create as much width between your shoulders as possible. Or like your mother said, try to stand up straight and tall, or retract the shoulders, where you're pulling the scapula together might be a better way to phrase it. So some integrative assessments. As muscles rarely work in isolation, assessments that consider the body as an integrated system involve various segments of the body responding to movements in a synchronous, coordinated fashion. Although the following patterns may seem rudimentary, keep in mind that poor posture, fatigue, repeated asymmetrical movements, stress, and poor exercise practices have the potential to corrupt even the most primal motor patterns. Reclaiming these basic patterns then feeds the reflexive and intentional stabilization strategies needed for more functional movements, such as the deadlift, squat, lunges, etc. The wall, plank, and roll is not only an assessment of the lumbar stability, but can also serve as an exercise to enhance lumbar torsional or anti-rotational control. The client should be instructed to face a wall with feet positioned approximately 2 feet from the wall. The client's elbow should be positioned on the wall with forearms lying one on top of the other, and then instructed to brace or stiffen the trunk and pivot on the balls of their feet while moving one elbow off the wall, ending in a side plank position. The client should be encouraged to rotate the entire body as a single unit. No lumbar or pelvic motion should be observed while pivoting from side to side. Once the client demonstrates sufficient stability for the wall roll, progressions can include side planks on the floor, initially performed on the knees and ultimately performed in a full body side plank position. Of practical relevance, in order to optimize the effectiveness of isometric endurance exercises such as the side plank, also called the side bridge, Dr. Stuart McGill recommends performing repeated sets of short duration holds, such as 8 to 10 seconds, rather than having the client perform one set of a prolonged hold, such as greater than 30 seconds. Although infants can roll with relative efficiency by 6 to 8 months of age, the pattern may become altered later in life due to mobility deficits or insufficient core stabilization. More specifically, demonstration of efficient rolling patterns reveals proper recruitment and sequencing of the core stabilizing muscles initiated within the deeper trunk stabilizers, including the transversus abdominis, the multifidus, diaphragm, and pelvic floor, and followed by recruitment of the more superficial or global muscles, including the internal and external obliques, the rectus abdominis, the quadratus lumborum, and the rector spinae. However, given the lack of variety of daily movement among many individuals, including athletes performing motions in one direction, asymmetrical rotational efficiency may be altered. The objective of the assessment is to observe the rolling strategy of the client in 8 different patterns, leading from all 4 quadrants of the body. Ideally, the client should be able to roll with equal ease in all directions. When first performing the rolling assessments, use limited cues, as the goal is to observe the movement plan and cheating methods. And here you can see, ideally with establishing a movement baseline, you want to first address the alignment issues. So you have to observe the quality of the movement. And you may need to provide them some additional cueing so that they are aware of what is expected with that particular movement. And then you want to do some instability training or challenge the ability to maintain their balance. There are times where clients have difficulty completing rolling patterns, in which case Table 17 and 10 and Figure 17.3.7.8 provide some of the common associated mobility and stability limitations and corresponding corrections. The rolling pattern itself can also be modified by placing a foam roller under one side of the trunk, just lateral of the spine, and that will assist the client in rolling away from the bolstered side. So here you can see the modified cobra stretch is one that's good to It does cause some hyperextension in the back, but it helps to strengthen those muscle groups and can be really vital, especially for someone who has back trouble. This is actually one of the exercises that is recommended. The bird dog, where it's opposite arm and opposite leg extended to provide that balance so that it's not one-sided. And so going through this exercise repeatedly. And then the glute bridge is important also for working the hamstrings and the glutes together. Here you have, this is called the side plank. And you can see it is on the elbow as well as the knee, so it's providing some support. Ideally, you want to get to the point where you can do a full side plank with hand down for more stabilization, but that's a progression. Other for strengthening the gluteus medius and gluteus maximus, as well as lateral. It's lateral band walks. Really helps to strengthen those inner muscles of the glutes. And then the clamshell, where bringing the legs in and out as well. And here, this is scapular retraction, which is when your scapula, most commonly known as the shoulder blade, moves closer to the spine. We have a tendency to keep our shoulders up and often move them towards their ear. And we need to constantly remind ourselves as well as our clients to keep the shoulders retracted. This movement is done with your shoulders down and back to avoid any shoulder shrugging or elevation. Also known as scapular adduction, and it is important in many exercises such as the row and the bench press. In these exercises, we perform retraction of the scapula to provide additional support for the shoulder and increase power and muscle mass. The scapular retraction muscles are the trapezius, the rhomboids, and latissimus dorsi. These are all the muscles of the back and provide that scapular retraction. And here, this is a band where we're working on external rotation, working on the shoulder, primarily the rear deltoid primarily. There are some instability training progressions that you can do for those with balance problems, trying to widen the stance on the floor, but stagger it. So one foot is forward and the other is back. To help increase your base of support. Try to maintain that optimal alignment without any swaying for 30 seconds. And you can do the same thing with a wide staggered stance on the floor, but keep your eyes closed and do that same thing for 30 seconds. Changes, again, the information that's coming in. You can do a wide staggered stance on the floor with the weight shift. So you've got one foot on the floor and one foot elevated, if you will. And again, you're trying to maintain that for 30 seconds. Here's another look at the different types of stances that you can take. The single leg stance with the eyes closed. Again, you're having to maintain balance. And a progression is where you're on a Bosu ball and trying to maintain balance on one leg. Stability, mobility, and sensory issues develop over long periods of time and are often mediated by lifestyle habits. Although exercise sessions are a critical piece of the repatterning process, the fitness professional should also offer recommendations that address lifestyle issues such as known to perpetuate muscle and balance. Suggestions might include improving the ergonomics of the work environment, setting a recurring alarm to serve as a reminder to stand and walk around the office, practice of diaphragmatic breathing, and foam rolling while watching television. Another important component of a well-rounded exercise prescription is managing hypertonic muscles and soft tissue restriction that compromise mobility. Although stretching approaches such as proprioceptive neuromuscular facilitation, or PNF, and static stretching are known to improve ROM, or range of motion, several reviews have reported significant deleterious effects on neuromuscular performance when done prior to activity. Conversely, several recent investigations have shown that SMR elicits improvement in range of motion without concomitant performance decrements when done prior to physical activity. SMR is based on a form of manual therapy believed to alleviate the discomfort associated with tender spots known with myofascia, known as trigger points, and relax hypertonic areas within soft tissue. SMR involves the compression of soft tissue using tools such as foam rollers, roller massagers, or tennis balls, and is performed by the individual rather than by a therapist. Currently, the mechanisms behind SMR are unclear, although prevailing theories suggest that the compressive forces imposed on the myofascial stimulate various mechanoreceptors that reduce muscle firing rates. Additionally, mechanical pressure induced by SMR may improve the viscous and fluid qualities of fascia, described as thixotropism. Other theories have proposed that myofascia becomes restricted due to local inflammation. Although it is unclear how SMR might reduce inflammation, there is evidence indicating that SMR transiently increases blood flow. To this end, increased blood flow may aid in the reduction of inflammation. Table 1715 includes a few suggested SMR and stretching targets for common alignment issues. You can see here in the picture some foam rolling activities. This is something that we'll work on this week. Although progressive overload is essential for improvements in strength and endurance outcomes, it should not come at the expense of proper movement patterning. To this end, it is critical for the fitness professional to recognize that stability, mobility, and proprioception are requisite features of motor patterning and collectively serve as the foundation for strength and functional development. Unfortunately, pervasive issues such as sedentary behavior, obesity and overweight, and limited variety in movement impair these foundational components of fitness. If insufficient stability strategies, lack of mobility, and low proprioceptive acuity are observed, fitness professionals must incorporate a systematic, progressive approach to improve baseline function prior to advancing the client into a more conventional exercise prescription. And that is all we have today, guys. You have a great day. I'll talk with you soon.